Varicocele is a dilation of the veins that drain the testicle. They're most commonly found on the left side due to the anatomy within the abdomen. The reason these veins are dilated is because the valves within the veins that should allow blood flow up away from the testicle into the abdomen don't work well, and they get overwhelmed by the pressure from the abdomen. This pushes blood back down those veins, causing dilation and stretching of the veins. That can make for a bad environment for sperm production. He might not know that he has a varicocele at all, but when they come to the office for an evaluation of infertility, that's one of the things that I look for on exam, and I can point that out. Most men with a varicocele don't have any symptoms and don't notice it, though some people do have pain. Classically, if they have pain from a varicocele, it's a constant dull ache that seems to get worse as the day goes on or worse with activity. It seems to be relieved when they rest or lie down. There's not really any medication that's going to get these veins to reduce to a normal size. I offer a microsurgical varicocele repair. I think using the operating microscope is important because it helps identify other vital structures in the spermatic cord that you want to preserve, and it also helps you identify all the veins. Those veins are then tied off and divided, therefore interrupting that negative backwards flow of blood. Patients always ask, well, if you divide all the veins, what's going to happen to the blood? The blood still finds its way out of the testicle through alternate channels, and they do just fine. The recovery period is probably shorter than one would expect. We don't go through any muscle during the surgery, so though there is certainly some discomfort postoperatively, it's not as bad as most patients think. Patients often tell me they needed the pain medication for the first 2 or 3 days, and then they didn't even need that. I request that they not go back to any real strenuous activity for several weeks. Not everybody with a varicocele needs a varicocele repair. Usually we repair a varicocele if we think that it's negatively impacting somebody's fertility. Also, when people are experiencing the pain that is classically associated with a varicocele, that's another reason we would fix it. But a good number of men with a varicocele don't need any surgery whatsoever.